We talked about frameworks just now, and now what we're going to talk about is actualizing our innovations into reality. I'm sure that a lot of you are being drawn here by the discussion about intellectual property. I guess that some of you already have what you think is intellectual property. If you think it's intellectual property, I can guarantee it is. Because intellectual property covers everything that we can think of. Your thoughts and your ideas, whatever stage they are your intellectual property. So let's learn about protecting it. We are then going to learn about interoperability and how it's important for your innovations to speak to the existing systems, to speak to the Ministry of Health systems, to stick to the systems within the private sector, and how you can design your innovations to make sure that they are as adaptable as possible and can be used in as wide a setting as possible. And then the last group, we're going to have a joint group from IDI and from the Ministry of Health that's going to talk about a particular solution that has taken a long time from inception to actualization, but how interoperability has really helped this idea go from a small little research project to now a national scale-up project. And hopefully it will be a blueprint for how, you guys can get some ideas of how you might be able to do these things.
I see we have quite a number of people here. I don't know whether you're here to listen to intellectual property or to what other colleagues are going to share, but Judith and I hope that you're here to listen to intellectual property. All right. So whenever you're looking at intellectual property, the reason why it is important, why we're here to speak to you today about it, intellectual property is really just a summation of rights that exist when you have creations of the mind. And so we have different forms of intellectual property. Particular to innovation, we start with copyright. Because the innovations that we're looking at today are mostly digital innovations. That means they have an element of software. That means either software or hardware. And if we're looking at software, then the appropriate intellectual property right that we'll be looking at is copyright, which is a right that protects anyone that has any literary, scientific, or artistic works. And so we have different legal frameworks that protect intellectual property, and copyright is protected by a Copyright and Neighboring Rights Act. And so if you have created any sort of code or any system that operates using a computer, and that system is unique to you in the sense that you are the one that has created it, it is a new system. Whether you have actually adopted it from somewhere else or tweaked something here and there, that really doesn't matter when you're looking at copyright. And perhaps something that we should consider is that copyright is inherent in the sense that you don't need to register it for it to apply. But why we register it is that, as you know, especially if you're dealing in the spaces that we're dealing with, and especially if we derive our inspiration from the same sources, from the internet in many instances, or from the problem cases that we see, you will have a situation where maybe even 2, 3, 4, even more people have come up with the same innovation, and that's important for you to have a certificate, and that certificate will be evidence that you have created what you've created. Think of it like a land title. If you have bequeathed land, if someone gave you land, how would you show that that land belongs to you? Outside of having a land title, that may be difficult. But if you have a land title, it's difficult for another person to claim that they have any authority or any lien over that particular piece of land that you have. So that certificate, think of it as a land title. Think of it as something that confirms that it's you that has created whatever you have created. And it is important as well to be able to do so, because if you then copyright your system, if you copyright your innovation, not only does it add value, because one, the process for copyrighting, well, it's not too laborious, but there's some money involved. It adds value to what you have created. So on top of it confirming or affirming that you are the owner of it, it also adds value, and that value is what then you can then use to commercialize, because we're looking at commercializing these things. And if another person comes up with the same innovation, you just show them your certificate. Or if another person also tries to copy what you have come up with, again, you have redress if you go to court by showing them the certificate that you have, which is conclusive evidence that you're the one who has created whatever you have created. The other right, perhaps, that I'll be able to look at if you're looking at intellectual property is patents. Patents are solutions to technological problems. Now, just think of it in the simplest way possible. If there is, for those of you that are innovating, if by the time you're innovating there's a problem that you have identified, and then your product or the process that you have come up with is solving that particular problem. And so the product or process that you have used to create whatever solution or product that you have created is what would get a patent. And a patent, just like copyright, also affirms or confirms that you are the creator or owner of whatever you have created. I hope I'm not speaking too fast. Are we all still together? Okay. I hope we'll have questions so that we're able to delve into these issues even more. Now, with a patent, and this is something actually I was really impressed with the discussion from the gentleman who spoke. I think from PAPS AI. Do you all recall? I think when we're in the main hall. And so he has created a digital tool that utilizes artificial intelligence. Now, as to whether that particular product can get patent protection, would have to break down, because patents, you're looking at three things. One, that what you've created is novel, it is new, and has not existed anywhere in the world. It has what we call inventive step, which is that someone skilled in the art would not pick from any prior art, something we call prior art, which is anything that contains either drawings, schematics, anything that can be able to break down that particular product. That someone skilled in the art would not have created that thing that this person wants to get a patent over. And number three, that you can be able to produce it in a factory or in an industry. Now, key to innovation, and this is why I think we're here, there is a provision under the law that says that if you create something and you want to get a patent for it, as I mentioned to you, novelty is one of the key, or one of the biggest considerations we look at if you want to get a patent. But that novelty can be taken away from you if you disclose your patent to the public. So if you are at a conference like this, and then you break down exactly what your innovation is, without taking time to register it first, there is a possibility that your innovation may lack that aspect of novelty, because what you have disclosed now forms part of what we call prior art. And that's something really I want all of you here to take away from. That if you have any solution, if you have any innovation that you feel could be able to get patent protection, register it first before you disclose it to the public. Otherwise, it's going to lose that novelty. And then I think those two really are the most important. The third one is trademarks, but this is one we usually use in trade. A trademark is one that distinguishes one good or service from another. And that's also important if you're trying to identify your particular product. Like PAPS AI, I was able to remember the name because after I looked at their website, their logo is clearly distinct. Or even IDI. If you look at even the conference itself, the Health Innovation Conference, it does have a logo. And that logo is what is distinctive enough to be able to distinguish this particular conference from any other conferences, and that's really intellectual property at work. But we need to even go further. IP is important. Whether you're a policymaker, whether you're a student, whether you are a researcher, it's important to you, as I mentioned, because it affirms that you have created what you have created. But that is important because it then allows you to be able to continue researching. The reasons why you'll be able to get a grant, why you'll be able to scale your innovation, is that it has structure. And that structure is what we're looking at, protecting that particular structure. That you have an innovation, you have a product, you have a process that has made something easier. And so you having those things will confirm to anyone that you're trying to get money from, anyone that you're trying to sell it to, that there is thought, that there is some sort of organization that has gone in order for you to be able to produce what you have produced. And that's why it is important for you to think of IP at the beginning, even before you're able to take your product to market. And so outside of that, I wanted to introduce you to intellectual property policies. Now this is for organizations and entities like IDI or other policymakers that are looking at or that have people within the organizations that create intellectual property. Even for you who is creating for the organization, does your organization have an IP policy? An intellectual property policy is just that. It governs exactly how the organization should be able to handle its intellectual property. And that is important if you're looking at things like ownership. Did you all hear about I don't know what to call it, the noise that happened when this guy who created COVID, Professor Guam? Did you hear about that?
Yeah.
You heard about, do you know what that was about? Because the university was claiming that he's the one who had, so that it was the university that owned COVID. Professor Guam was emphatic that no, I created it outside the scope of my employment. And so that's, having an IP policy is important, because what that does, it guides that if someone is going to create anything within the context of an organization, what ingredients, so to speak, do you have to tick off the list to be able to affirm that that person has created it for the organization? It's not, you shouldn't just assume that just because you're employed, that anything that's created within the course of employment belongs to the person who has employed you. There are many scenarios, and under the law, those scenarios are if you've created something outside of the scope of your employment, outside of your employment contract. But beyond that, an IP policy helps to be able to dictate and clearly determine what happens. Outside of that, there's something within our law that's called a technovation certificate. This is something we don't usually talk about. But a technovation certificate grants you, the employee, the right to be accredited as the person who has created something within the organization that you work for. Because anything you create in the course of employment does not belong to you. It belongs to your employer. But in many instances, you find that you created something that has fundamentally helped your organization, or that has really even put them on the map. And so it's important for you to get credit and maybe even receive some sort of money in order to be able to say thank you for what you've done. And so that innovation certificate, that's among the things that we include in our IP policies. Outside of that, for an organization as well, it's also determining if I contract other people to be able to create software for me, to be able to develop a product for me. Because usually an innovator must work with other people for them to be able to create the product that they have actually come up with. And so the IP policy also dictates, if I'm working with other people, should I license them? Should I get licenses from them? Let's say they have software that's already finished, and I'm just using it within my system. Should I co-own the system with them, where we are both going to receive royalties or going to receive money after we commercialize it? Should I own the intellectual property, where I am clearly commissioning whoever is working with me and they assign all their rights to me? Whatever model you're looking at, you must have a policy that guides exactly how you're going to move forward when you have a policy. And so there are many advantages to it, which I've already been talking about. One, providing legal certainty, promoting scientific research and technological development. And that legal certainty really is one that I must stress, because we've seen all the cases we've seen and handled where there is where there are issues regarding intellectual property, all go down to ownership. Where there are two people, an organization and an innovator, who are fighting over who owns the innovation. But because you have not thought about signing a contract or agreeing on the terms at the time that you come to create something. So for all the innovators here, you must know this intellectual property thing. It is not something that we just talk about in law, but it's something that should be close to what you do and in everything that you do. And of course, outside of that, it also provides an environment that supports and encourages innovation and also ensures compliance with applicable national laws and regulations. So I've already mentioned to you what is in the policy. That's what is on these slides in terms of ownership of things like source code, if it is software, the roles and responsibilities of the parties that are involved, engagement with third parties, and the nature of that particular engagement, and any incentives for reward. And if there's any information as well that is confidential, that shouldn't be used in any other innovations. These are all things that are included within an IP policy. And so this one I was looking at addressing ownership of intellectual property within software. And as I've mentioned, usually you can either get a license, you can co-own, you can be joint or co-authors if you're working with another person to develop software, or you can also be commissioned where you assign all your rights in the system. But it's important for you to know the avenues available to you, because that also helps you to be able to price. For those of you that are creating these innovations for organizations, how do you bill? How do you know how much you're supposed to, the price tag that you put to a particular innovation? One of those is understanding the rights that you're going to give away. If you're giving away all your rights, then I'd advise you bill higher. If you're going to give a license, then of course the fee must be commensurate to what you're giving. Or if you're joint or co-authors, you must also understand the level of what is the other party giving to you. Are they the ones funding, giving you the money? Because that's a very big component before you develop. Are they the ones that are giving you the technical know-how if you're an organization that has the money? And so it's very important for you to be able to determine the level of ownership. Is it 50-50, 80-20, 90-10? All those should be agreed before you start to work on any innovation. And so that's something really that I hoped to stress. And so I mentioned to you licensing. There's also you having subscriptions where someone subscribes to your product. That's also allowed. And that's also something that would make sure you have money across the board, over a longer period of time rather than just you getting a huge chunk of money and then, in the next year or 2 years you spend that money and there's nothing else that you're doing. So subscriptions are also important for that. And then of course you also have aspects of open source software, which is software you can get over the internet. And so I'll end with a model IP clause, which is for any organization that's contracting with anyone that is creating any system, that is creating any product or any innovation, that you must have an intellectual property clause, as I said, that speaks to the ownership. What is if you're going to commission the work in IP, you must be able to transfer those rights, and those rights have to be transferred in writing. And so that clause uses language that makes it clear if you that I'm transferring this software to the person who has commissioned it, and this is what I'm receiving in return as a result of that transfer. And so I think I'll end there so that I can have Judith perhaps be able to add more on that. Thank you.
Thank you so much, and thank you. Let's give Kenneth a round of applause. Given that this is what he dedicates his life to summarize intellectual property in 12 minutes is very, very impressive. So well done, Kenneth. Judith, is there anything you'd like to add? And then I think we'll take questions on intellectual property before we move to interoperability, because we're changing tack slightly. So please get your questions ready. This is free legal advice, okay? So take advantage. Thanks, Judith.
Thank you, Kenneth. Just to pick up from Kenneth's presentation and discussion, he's gone through everything that would fit in intellectual property for 10 minutes. So what I really want to take you through is how is this IP going to work for you? Because you're innovators, you're startups, you're in, most of you are in the healthcare system, but you're asking yourself, I have all these aspects of my intellectual property, all these patents and all these copyrights and all this software, but how is it going to work for what I'm innovating? I just want to start with a quote from the World Intellectual Property Organization. That's the United Nations agency that brings together all intellectual property offices and funds all the efforts towards making people realize the intellectual property. They said in one of their reports a couple of years ago that intellectual property rights are a useful incentive when there's private motivation to innovate, and this aligns with society's preferences with regards to new technologies, but this alignment will not always exist. It's unclear whether the IP system can incentivize innovation that is far from market application, such as basic science research. So you may feel like your innovation or whatever you're creating may be something that's isolated or something that's very basic compared to all the different innovations you've been hearing about in the main hall, AI and how it's transforming our healthcare system. But when you're innovating, you have to be alive to the realities of our society today. What are the problems that are actually facing our healthcare system, and how is your innovation going to be a solution to those problems? I think that was one of the most pressing issues we had in the early morning discussions. Everyone is innovating, but there was an example of one of the innovators who said you could be sitting in a room right now and you're sitting next to someone who is creating the same thing. So how are you collaborating? How are you talking to each other? How are you improving your ideas? Because that's what will create more value for your intellectual property. Don't just look at what you're creating as something that is going to exist alone. How is it going to benefit our society? Because that way you'll have market for whatever you're creating. So you may have intellectual property in whatever you're creating, but understanding the market, understanding understanding all the the problems that we have with our healthcare system will help you understand where you fit and where your solution is going to be something that can help, that can scale our healthcare systems. I think many of the innovators were speaking about funding and where you receive funding. Funding may be in academia or in the public sector, because the ministry, health is a public good. So that's why the ministry is very intentional about providing funding for you. But you have to be able to answer the kind of problems that we have in our healthcare system. We have a national health plan that's set up every couple of years. Where are we going? Where have we been? And how can we be able to improve our healthcare system? Look at ways within which you can innovate within that. That way the ministry can be able to listen to you and see how they can take up your solution, and you can be able to work together with them. So don't just look at your IP as something that's fragmented or it's existing alone, or you don't know really who is at the end of the value chain for whatever that you are innovating. Something else that I can mention about your IP is look at regulation. When you think about the law and the legal frameworks, don't just think about registering your IP and what's going to happen after you register. What kind of rights do you have? Where do they fit within our system? If you have a copyright, it's not just about having a certificate. How are you going to realize the value within your creation? Can you license it? Can you collaborate with somebody else? And all these issues, I think we have the common denominator in all of them. It's really a knowledge gap. But if you talk to each other, if you talk to other innovators, you can realize exactly how much value is in what you're creating. And it's not just about registering and having your value fall within a certificate, but everything that your creation can do and how it can even be more maximized by collaborating with others. We talked about patents. Patents, I think, was something important with that Kenneth talked about on innovating, because it's really the most practical intellectual property right framework that we have. But being able to register a patent may not be the only step towards being able to commercialize. You have to be open towards learning exactly how you can collaborate with others, how you can license it, who you can license it to, and looking at registering your patent even while you're innovating. It shouldn't just be an afterthought. So those are just a few of my thoughts following up on the earlier presentation on IP, but IP shouldn't be an afterthought while you are innovating. It's something that can protect whatever you're creating, and you can actually make money off it. So try and talk to each other. Widen the knowledge, widen your knowledge base, because then you'll be able to understand more about what you can do with your innovation and how it can help us in our healthcare system.
Haran, my first question is, if I discover my invention is not patentable, how can I protect my intellectual property?
I've heard of a scenario where a group of individuals call for abstracts, then people who they actually send in their abstracts, and then of course they send you, they will regret to inform you reply, but then they go polish up that abstract and then submit it to other bodies. And before you know it, your project is being implemented somewhere. So I would like to ask Mr. Mohanje, if someone approaches you to register an IP, are there any steps taken to identifying the authenticity of their IP, or once I bring it and I say it's mine, then it will be mine? Thank you.
He spoke about novelty, and he said that if you never have an idea and you disclose it, for example, in a conference like this one, that will affect the novelty of the idea. So how do I protect novelty even while having discussions with fellow innovators? And then to similar to hers, but in a less formal context, if I'm having discussions with these fellow innovators, how sure am I that my idea will remain protected and someone will not pass it off as their own?
Kindly, okay. It's about, for example, our cost. does it depend maybe on the bulkness of the innovation you've made, or it is constant for every innovation you do?
I think one was from Aaron about discovering that an innovation is not patentable. Well, the beauty of intellectual property is that you don't just have one right. You have many rights that you can be able to go to. So a patent really protects solutions to technological problems. However, you can still get that same protection for, let's say, for copyright. So patent is actually a little bit more stringent, a little bit more restrictive, in a sense that you have to have that novelty aspect that I spoke about. It has to be new, and that novelty is anywhere in the world. No one else in the world should have come up with what you have come up with. That inventive step, which is that someone skilled in the art would not have arrived at your same conclusion if they had the same information material that you had. That's why that novelty is important. And number three, that you can then be able to use it in a factory, so you can be able to mass produce it anywhere. And so even if you don't have protection under patent, there's actually also what we call a utility model, which is similar to a patent, but the protection is for, I think, 7 years rather than 10 years. And for a utility model, you actually don't need to have that inventive step that we're talking about. So if your innovation lacks that inventive step and may not get a patent, you may be able to get a utility model, and that still gives you the same protection. So outside of really of the health space, one of the innovations that we actually registered and got a utility model for was, have you heard of Janzi Band? Yeah. They created an instrument called the Janzi. Sewa Sewa, I think, is the leader of that band. That instrument has a utility model, and so that's really just to give you an example that you don't even need to have something too complex in order for you to be able to get protection, but you can either get a patent or get a utility model. Outside of that, as I said, if you have software related to it, you can also be able to get copyright in that. So there are many rights that you can be able to look at, and so don't be restricted to just one thing. And the protection, of course, is going to a registry, submitting those documents. We have a Uganda Registration Services Bureau, URSB, that has an intellectual property office where they're able to register your intellectual property. And that was a very good question about competitions. Really, that's where we're here. To tell you that, one, before you enter into any competition, before you give your knowledge to someone else, have a framework that will protect you. In the first instance, of course, for competitions, it's a little more difficult because then you're going with whatever has been granted. However, if the competition does not have rules, you yourself, when you're submitting, just adding, you can bold, if you're submitting, let's say, over email or in a paper, just put confidential for, for submission purposes only. That will protect you, and you don't know actually how just that one sentence will protect you a lot. Because if you submit it in confidence, something that we say is that intellectual property, or copyright in particular, does not protect ideas. It only protects the expression of those ideas. So you may not be able to get redress if you submit your abstract and someone else has polished it and then submits it as their own. However, we have what we call the law of confidence, which is that if you submit something in confidence, and if you've done it in a manner where you've told the person, I'm submitting it in confidence, then if they use it or any aspect of it, you have legal redress. And we've seen many cases where people have sued people that have used their abstracts or their ideas. Basically, those ideas that you submit in the form of either of a competition or if you're pitching to someone to be able to get business. So that would be the free advice that I would be able to give you. And then lastly, the question on novelty, I think Judith will answer the other ones. How do you protect novelty? So how do you, well, the law says that if you disclose your innovation within 12 months, you can then be able to register it still as long as it is within that 12-month window. So as long as it is within that 12 months, maybe I would say, but before that, I would say protect your novelty first by applying for a patent before you disclose it. Even before you go into any competition like we're talking about anywhere. And that then brings me to his question, which I'll answer it for currently. It's not very expensive to register intellectual property. And now we have mechanisms where you're even able to get support from government. So I also advise the Ministry of ICT, a national government, and we have programs where we can support innovators for you to be able to, for government either to subsidize the cost if you're an innovator, or even to give you the money to be able to register your innovation. So you can go through Ministry of ICT. There's a program called the National ICT Initiative Support Program, NISP, which does that. And I'm sure even any other ministry, if you went there and asked them for support, or URSP directly, they can be able to do so. So the cost, the biggest cost is of course maybe the cost if you have a patent for examining your patent or your innovation to see whether it can get protection. And that's usually where the highest cost is. But the other costs really under $1 million, I think you can be able to, well, patents are a little more expensive, so maybe between 1.5 and 2 million, that's a cost that we're still trying to bring down. That's why I said if you need support, you can be able to get support from many avenues and many channels as well.
In intellectual property, knowledge is power. When you know what you bring to the table, you'll be able to protect it. You can't protect what you don't know. So you have to understand what you're creating and what you're bringing to the table. When you're making a submission, for example, in a competition, if you know what you've created, then you know what intellectual property will be subsisting in that. You'll know if you have a copyright, maybe you've gotten a copyright certificate, or if you've registered a patent, or even a utility model, then you will know what asset that you actually have. That way, you know if you need a confidentiality clause, if you need to put up a disclaimer. So you should be open to understanding exactly what you've created in the aspect of intellectual property. The knowledge is what will help you to protect it. That way, it will not be an afterthought. It will not be something that you realize when you have already given it away or relinquished it, maybe in a competition or through a commission that you may not have contractually understood. So be able to, feed yourself with the knowledge, understand what you're creating, and then you'll be able to protect it.
I would just like to understand more about what a trade secret is and of what importance is it to an innovator.
When I'm patenting, what am I really patenting? Because I can take an example of the M-Scan. Yeah, the M-Scan, it's a mobile scan, and they drove their idea from an ultrasound. But now they have their idea that we have seen the challenges. Let us make a mini ultrasound, and it will be mobile. We shall use a probe and the likes. But now another one can come and be like, I also have another idea. I'm also going to make a mobile scan, but maybe mine will not use a probe. Now, am I protecting the final product, or am I protecting the process in patenting?
A trade secret is something that's protected in Uganda. We have a Trade Secrets and Protection Act. So it really goes down to the quality of information and quality of what you're trying to protect. If you feel that you've come up with something that's very confidential, that you need to protect, especially if you're going to contract or partner with someone, or work with someone, or give it away in a business deal, then you can protect it. Even contractually, you can have a confidentiality clause where you state that both parties are aware of the quality of the information and that is confidential and of the high value of that information. And when that clause is breached, then you're entitled to something that we call damages, which in our law is basically compensation for the loss that you can incur because that kind of information is lost. So contractually, you can protect yourself as long as you're aware that what you actually have is information of a high value and that you're bringing that to the table, then you can contract in that way and be protected.
For those of you that like Rolexes, if you go to a Rolex stand, you will most likely want to keep going to that stand because of how nice that guy makes his chapatis and eggs. Now, in order for you to keep going there, if everyone else in the area had the same way that the guy makes it, it may be difficult for him to have a unique product to sell. And so a trade secret helps you to protect how you actually make something. So I think there are products like Coca-Cola has a trade secret in its recipe.
Coca-Cola, think of Pepsi. KFC is, I think, they've set an example for all of us.
I like how you ask. So for patent, as you said, you can patent the product or the process. Now, for patent, as I said, a patent is a solution to a technological problem. And you must have those three things: novelty, inventive step, and industrial applicability for you to be able to get a patent. Now, in the example that you gave, and I like how you talked about M-Scan and talking about how these people have now created a product which similar already exists, but now you're using either different technology or another way to be able to approach it. If you can show that your product is approaching an already existing product from another way, and that way is cheaper, maybe it's even, it then gives you a better product, then you may be able to get a patent. But most likely, if that already exists, and that's what I mentioned, when you look at the definition of what we call prior art, prior art is anything that has existed before your filing date, before you apply for a patent, but that art, if someone skilled in the art was able to compile, let's say there were 6 documents, or there were 6 machines that already existed, and you want someone someone who is skilled in the art, let's say you, who is now going to graduate with a biomedical degree, if you're able then to collect all that information and create your own machine, then you'd be someone skilled in the art. And if that's the case, then you may not pass that test for inventive step. But that's why you have a utility model. A utility model does not need that aspect of inventive step. All you need is something that is new and something that is industrially applicable. And once you have that, so most likely this M-scan would get a utility model rather than getting a patent because of the reasons that I have just given. But it's possible for you to get a patent if you can show that your product, although it already exists, you have found another way to be able to create that particular product, either by using different ingredients or by using a different process. Then that's why they split, and you can get a patent for a product or a patent for a process.
Good afternoon, everyone. My name is Samuel Luwama. I work for METS. METS is monitoring and evaluation technical support. We work so well when it comes to strategic information and information system, health information systems. We range from electronic medical records, supporting reporting, supporting interoperability of different systems, and ensuring that the healthcare systems work. So, besides that, we have a product that is in over 1,400, 500 facilities. That is Uganda EMR, that deals, it's mainly for electronic medical records of patients. So we have that scaled across multiple facilities across the country. So, when Moray is asked to speak, I always ask myself a question: where did this journey start to arrive at a particular point to speak? It started at a point where I picked interest in systems, making sure that systems talk. I had systems that just there. You would regard those ones as legacy systems. I love systems that can talk to each other. If at all you create a system, how can it talk to another system? If you've noticed as of today that mobile money at first was created specifically to transact. Let me just put at MTN mobile money. It was specifically created to transact within MTN mobile network, right? Until they realized the power that they need to get it out there so that it can be able to be used in trade. To just simply have money where you only access it at specific services, it doesn't add up. You need to be able to integrate so that you can be able to work with other systems that will add value. Today I can pick out my phone, I can move cashless out in the entire Kampala, and times even up country, because I can pay via different approaches because someone decided to make systems interoperable. Okay, so next slide. So this is the problem statement. There are a number of health information systems that cut across in the health sector that work differently to take care of a patient. Let me give an example. You will have an electronic medical record system. That one keeps patient medical records systems, right? As it sounds, you will Google about it, you'll find your answers right there. You'll have LIS, Lab Information Systems, that cater for being able to look at how you test a sample that has been given to you, and also give it results. Logistical Management Information Systems, those ones cater for how do you move drugs, how do you move medical supplies from one place to the next until the last person who gets to consume them. So there are so many other systems. You've created an app, you're like, I want to be able to have patient information given to the patient. So many apps which you guys keep on coming up with. So you want to be able to make sure that these apps communicate to one or the other platform. So the fact that we have that kind of problem that of you have many systems and you cannot stop innovators, can you? You can't. People keep innovating systems, so you have to be able to allow systems to be able to work together. Okay. Next slide. So what is interoperability? Ability for computer systems or software to exchange what? By the way, I also lecture sometimes, so, and I come from a line of teachers. My grandfather was a teacher, my dad is a teacher, my mother was a teacher, my aunt is a teacher, my sisters are all teachers. So when I keep asking, so although I decided to break the word. So information, I'm taking up towards here, to exchange and make use of information. Exchange and information, those are the two things I'm picking out. So now I'm going back to the very topic, health, interoperability in what? Health care system. So that brings us to the crucial part that says health information what? Exchange. So what is health information exchange? Sharing of health related data electronically across different systems. So there are two things that you get to think about when you talk about health information exchange. You have what you regard as horizontal health information exchange. This is information exchange that is within the same organization, let's say a hospital. Any system that requires information within that same hospital is regarded as horizontal exchange, because that information is not going to be able to move out of that hospital, but it's going to be within the same space. So let's say if at all I have a system that works in my department within a given organization, I also have another system that works in another department. If at all we exchange information within that same organization, is regarded as horizontal. So when it comes to information moving out of that organization to the next organization, that turns into what you call vertical health information exchange. And that, that is where you might actually escape standards when you're looking at a horizontal, because you guys, you know how you can make sure you can work with those systems. Since you're one organization, right? You can change a variable today and you will be able to change it in another system, and that will work fine. But when it comes to vertical, when it comes to vertical, that means you need to be able to work with multiple other systems. So that means you need standards. Okay, let's go to the next slide. So I think Edward was able to project this in the same room. So it's not clear, but the slides will be shared. So at the lower level, you have point of care service systems that serve patients. And then in the lower, you have the interoperability layer. And then at the top, and then somewhere in the middle, you have what they regard as registries that help to exchange information, and then on the top you have know your national systems that work well to help you keep the information. Next. So when it comes to standards, in order for you to be able to have health information exchange, you need to be able to have standards. So we have 3 main standard types that we really need to focus on. One of them is messaging standard, or the IT people, semantic. There are 2 things that we usually say: semantic and what? Semantic and what? And syntax. So we have messaging, then we have vocabulary, security. That one I'm not going to go into it, but the 2. So messaging standard, how does your data look like, or the structure of your data? So in the health sector of Uganda, we strictly have what FIRE. There are a number of other standards, but I want to focus on HL7, which zeroes down to FIRE, which stands for Fast Health Interoperable Resources. And then down at the vocabulary is the meaning of what you're exchanging. So the system needs to first of all understand the structure of how your data is structured. If at all I say I'm exchanging a patient, where do I find the name of the patient? Get it? And where do I find the structure of how actually I capture a specific variable? Then when it comes to when it comes to meaning, you're looking at how do I define a viral load, okay? What does a viral load mean in the other system? What does viral load mean in the next system? So data that varies, so you need vocabulary, and we come into what we regard as terminology services. Next slide. So readiness of the system to make sure that it is that it's interoperable. People, you're going to give me 1 minute because I need to emphasize this. People are very key. So you need to be able, remember that you're working with other people. So as you're working with other people, you need to be able to train. So like I'll give you an example. While we were working with data access in order to integrate together, we kept on emphasizing that we cannot define our own standard. We need to be able to use standards that are known, okay? We were able to use FIRE and then CINOMED and all that to make sure that we understand it, and then also that in case of any other system that comes across, it can be able to what? Work with us. Making systems compliant to standards, that's very key. Identifying standards that are based on in a given health sector scope. So that you might find some countries where they have their own standards that they define, but in case you have international standards, you could use those. Utilization of libraries towards aligning with HIE in order to, this is what I usually call shortcutting. Like instead of you building your system from scratch to be adhere to standards, you can actually use some libraries to shortcut and then map your system to that library. Next slide. How has it been used in Uganda? Next slide. So these are the series of systems that we've worked with that have dealt with health information exchange and have some standards in it. In case you want to know more about it, you'll come to me. Okay. So I know the next speaker is going to land into this one. That's why I wanted to point into it. So when it came to access and Uganda email integration, we looked at these standards: FIRE, CINOMED, LOINC, RX norm. So FIRE, I already spoke about it. CINOMED is a standard dictionary that makes meaning to medical terms. LOINC for lab, and RX norms, that is specifically for medications. Next slide. So someone is going to be more elaborate about that, but about the access integration. But we were able to build something together using standards. If at all today you speak about plugging in another system, you will be able to plug it in easily. So when you're building a system, think, especially for health, especially people who are doing device integration, make sure that there is capability for standards to be able to work within that integration. Thank you.
This is the solution. So from patents to standards, this is the product. So we want to take you briefly through the product so you can appreciate what we've, and then measure that it's taken us a long time. And so we'll hopefully try and take you through the challenges, and by the time we're done, you'll appreciate what we have done with interoperability. My name is Edison Katunguka. I'm monitoring and evaluation specialist with the Infectious Disease Institute, and this is what we do. Most of us have walked into health facilities, especially the public health facilities, and you've seen how long the queues are for the ART patients, I mean. Yeah? So this solution was born out of a challenge. And we've already been informed that let's not run away from challenges, because from these challenges is where we pick our solutions. That's right there. So we discovered that because of the programming, we are retaining a number of patients in care, and so the volume of our patients at these facilities grew. And so there was all these long lines, and our patients were complaining. I come here at 8 a.m. and I'm leaving at 11 or even midday. So we thought, so what do we do about this? And so the IDI KCCA Community Pharmacy Refill Program was born. What is it and what did it aim to achieve? So we wanted to decongest the health facilities, like I've mentioned. But we also wanted to make sure that we scale up what we call MMD. MMD is short for multi-month dispensing, where for plants that are stable, those of us that are in the health space, for a plant that is stable, we don't have to see them or come to the facility so many times. So we give them a long time period for them to come back and see the clinician. We give them drugs enough, maybe 3 months or 6 months, and now we're even going all the way to 12 months. We give you drugs for 12 months, and you'll come back and we'll see you after 12 months. It has so many advantages. Those of us that are really interested, you can look it up. So we also reduced patient waiting time at the facility, but we also wanted to solve a major problem of transport costs. Most of our clients that we support are challenged by coming to these health facilities. And so we thought, how do we solve this? And so this is the solution. What is it exactly? We partnered, and you've heard of private-public partnerships. As health facilities or as IDI, we partnered with local private pharmacies. Of course, there's a process that was undertaken, MOUs were developed, we assessed safety of the drugs at these pharmacies, but also assessed how the client would actually not feel pressed. So we engaged private pharmacies to dispense ART drugs for our clients. So say I stay in Nankulabye, I don't have to go all the way to my health facility. I will work with the pharmacy next to me. I think one of those is called Cedars. So I'll go to Cedars, I have a patient health card, I'll show it to whoever is working within the pharmacy, and I'll tell them I am on this program and I would like to pick my refills. You get it? Is it making sense? Okay, so first go back please. So we ensured that with the support of the academy and METS, we developed, we supported documentation of ART refills in this system. Now the system at the pharmacy is the solution now. We call it ART access. It is really simple like that. How are we accessing ART? And this is what Samuel had mentioned a little while earlier, ART access. So we facilitate efficient ART delivery without additional human resource. Previously, before, when it was in its infancy stages, we had nurse dispensers. And so we had to make sure there's a nurse dispenser at a pharmacy to work or interface, meet the clients. But that was a bit costly. Remember, we are into health system strengthening. And one of the key blocks is to ensure that you use minimum resources, because we all know we're a resource-constrained country. Those are settings we work in. So the system has helped us now take away the need for us to work with a nurse dispenser at these pharmacies. Because why? The system will speak with the parent EMR, Some talked about it earlier. It's called Uganda EMR. Now, Uganda EMR will say, I'm client X, an appointment has been given this long, maybe 6 months, or maybe come back after 12 months to this facility. But remember, you will need to go to your pharmacy to get maybe a refill, okay? So when you go to the pharmacy, Access will already pick information from EMR and vice versa. You get it? So that is interoperability. So, and that's what you're saying there. We provided a communication link between the pharmacy and the facility Uganda EMR system. And then of course, Access will help us monitor stock movements. Because remember, we're picking stock drugs, ART drugs, from the parent facility and we're giving them to these pharmacies. So we need that system to help us monitor stock movements. All right, so that is Access, and this really has been our success. As I've shared with you, we've achieved real-time stock monitoring, but we've also seen that whole bidirectional exchange of data and information between the Uganda EMR and the ART Access system. And of course, it's an easy system to use. It is web-based. You just log onto the browser, have the URL, and you'll be able to get it if you have the credentials, of course. And then it's easy. It has helped us to report. You can all imagine that this client who last came to the facility maybe so months ago, and now we need to make reports on, say, we usually do a lot of indicators, some that determine if a client is active on care, and there are all these definitions to determine what that means. But we needed Access to help us determine that this client, although they've not come to the facility, and we've spent so long without seeing them, they are actually still active. They're still picking their drugs from the pharmacy. You get that? That is very important. Otherwise, they would not know. You know, you can tell a client, you'll go and pick your drugs from this pharmacy, and they will not. And if they do not, you'll know what happens, not so? We will see viral rebounds, and then before we know it, they're transmitting, and before we know it, we are losing whatever we have accomplished in all these years trying to combat HIV. So, of course, like any other solutions, it hasn't come without any challenges. And of course, in the beginning, we had issues with the enrollment criteria. There's a criteria for DSDM, which is really differentiated service delivery modeling. So the Ministry of Health has a whole set of guidelines, and we needed to work within those as we were pushing out Access. But also, we also noted a slowness in the speed of synchronization that has since been resolved, and so we put this out there as things that we need to look out for in case we are building similar solutions. But lastly, we've also noticed, please go back a little bit, we've noticed that these systems have a lot of stakeholders, yeah? So there's a lot of time that is spent, rightfully so, but I mean, a lot of time is spent trying to get all these views from the different stakeholders, trying to put them all up together to develop the system. So I'm going to ask Eva to come and just give us a snapshot of what the system looks like, what is our landing page, but also how do we get in there. We'll close with that. Thank you very much.
Thank you, Edson. So we have limited time, and sometimes it's hard for me to speak about Access in a few minutes, but I'm just going to go through it, and I tell you how we developed it briefly. So according to what Edson has said, even after the community review, there were still challenges. So we went ahead, we used what we call a human-centered design approach, where you go to different stakeholders who are involved in the program, and then they inform the development processes according to the need. So we came up with a system. The system has 3 interfaces. Like we have a pharmacy interface, a facility interface, and an admin. So the admin interface allows, like at the moment, the ministry and all the high-level stakeholders to be able to monitor and follow the processes, the implementation of the whole project. Then the facility interface, that's what we have integrated with the Uganda EMR. So during the process of development and piloting, we found out that facilities cannot use 2 systems at the facility. You couldn't tell them to enroll through Access, yet they have Uganda EMR. But now at the moment, the facility interface sits within the EMR, and then they do enrollment like in a few clicks, and that is done. Then the pharmacy interface is that what sits at the pharmacy. It's what we use to do the refills. When a patient shows up, the pharmacy knows you're on schedule. They can do prediction of schedules. Then we went ahead to develop a stock management module. Like he has talked about, the stock management module is really for tracking of the the stock. This is government medicine which we've sent to private entities. So what ATAccess does is it monitors the 360 cycle. The pharmacy orders for stock within the system. The facility approves the stock requisition. Then the stores at the facility issues stock, and the pharmacy acknowledges receipt of stock. And when a patient comes to the pharmacy, you're able to dispense within the system. So we know I can sit in office on my computer and I track. I know that pharmacy X has dispensed to these many patients a day, and I make reports. So we have a number of reports the system can be able to generate, and I submit to MOH on a weekly basis. In the interest of time, we shall have, this is just to take you through how the processes we've gone through, and I think we've mentioned all of them. The digital PCT is when we digitalize the IDI PCT clinic before the MOH, and now where we are right now, the national scale up. Thank you.
So maybe we'll just give the last words to Dr. Ivan to perhaps, following the example of art access, from your perspective as Ministry of Health, what should young innovators, what mistakes should they not do that we did? And what things made your life easier as the ministry in terms of implementing or allowing this to go to scale?
Good evening, everyone. Dr. Ivan Arinaitre, and you should understand the problem at hand. The problem here was that we had many of our clients at the facility wasting time, yet they're just picking drugs. I can do a pickup anywhere. Let a border drop it for me, I can pick it from a supermarket or a pharmacy, and that is what the team did. What is the problem at hand? Don't come and innovate for us something because you think it is what you want and you think it is what ministry wants. You will stop there, okay? The second bit was the buy-in from the different stakeholders. If you're innovating, are the clients we are talking about, do they want this innovation? What Eva talked about? Ask them. We want you to pick medicine from somewhere else. Do you want it? If it is a yes, you're on the right road. If it is a no, then that innovation will not move on. So that's the second bit. The third bit is, as they piloted through, one thing, there was a question that how do we bridge anything to do with the ministry and the innovators getting to know what's happening. Once you're doing something that is benefiting people, the ministry will know. Any ministry will know. That means you're solving issues, and we will always get there to get more. And once you've even gone ahead to pilot, it makes my work easy. So I just come in to get what you did and simplify it to the level of the lowest earner as a Ugandan. So if you did your pilot at $10,000, I am bringing it down to 10 to make sure it is affordable for everyone. And that's how we move. What did we learn from IDI? Yes, the model of implementation could have been different, but it helped us that as a Ministry of Health, we looked for a cheaper and better design fitting in what IDI had, such that it can be rolled out to the nation. And that is how it is coming in. Second bit, digital world. We are running away from the paperwork. when you go to most government places, you're carrying a book or someone is giving you a paper somewhere. But when you go to the private facilities, the good clinics, you're moving, they're just telling you, go here, go there, go there. So you don't carry anything until you're given medicine. So that's why it is. At Access is digital, EMR is digital, you don't need to move with anything almost. And this has helped us to scale up, because as we scale up, the little we got from the about 4 or 5 facilities in development, and they were high level, and you take them across the nation, you have a lot. But also as you do them across the nation, you're still learning, because what they did was in Kampala, the dynamics of Kampala are different from Gulu, they are different from Kabale, they are different from Jinja. So each station you learn something new, and every time you're doing that, what you learn helps you improve. And I think that's how far we have come. But most importantly, innovate something that is valuable to the people, and ministry will be with you.
That we have gone ahead to try and register the Art Access Tour through legal support, because we now want to take it outside of Uganda. Within Uganda, our customer really is the ministry, and they are already using the tool. So our job is done in a way in Uganda for HIV. Maybe we want to use the tool for hypertension, for diabetes, any chronic condition where people spend a lot of time going back to the health facility. But also, we want to take it outside of Uganda. This is a Ugandan-born product developed in Uganda, but we think it's applicable to other places. So the reason that we are going down the registration route, the intellectual property route, is, so that we can expand our operations. And so that actually what Kenneth and Judith are talking about, that the team that worked on this, that everybody that got involved, that the organization are very clear about who owns what, who led into this, who has contributed to it, because there were lots of different funders over the time, and actually documenting everything nicely. So this may not be a valuable thing in the future. It's valuable to the patients. It may not be financially valuable to anyone. But if it did become valuable, at least we would have everything in place so that there would be, a clear plan of what was happening. So I hope this session this afternoon has given you, first of all, some theory about intellectual property. Secondly, some interoperability issues about the importance of your innovation being interoperable. Finally, an example of where this is really, what IDI has learned, and the ministry and MET, all of us have learned together, in fact, and I hope even our legal friends have learned from our process. And then back to the intellectual property at the end with a product that we're using it here, but we're only just doing the legal aspects now. So learn from us, do your legal things early. And please do come and get guidance, make contacts, talk to the team afterwards. And thank you for sticking with us and for your great questions late into the afternoon. Well done and good luck.